tell you about, as a physician, about these 3 cases that I have seen in my practice. Nadia was 32 weeks pregnant when her blood pressure suddenly spiked. Her feet were swollen, her vision blurry, her head pounding. After a few tests, checking her urine and other things, blood pressure, the diagnosis came as Preeclampsia. A simple blood test sometimes revealed something else that day. Her vitamin D level was severely low because she spent months indoors, dark-skinned individual, little sun, and inconsistent vitamins that had quietly depleted her body. We explained to her that vitamin D helps to regulate her blood pressure, blood vessels, and the placenta. Without it, inflammation rises and blood pressure can spiral. With treatment, supplementation of vitamin D, and close monitoring, Nadia delivered safely 2 months later. She later said, I quote, "I never knew a lack of sunlight could put my life and my baby's life at risk." That also reminds me of an 80-year-old Samuel who was always sick. He suffered from colds, ear infections, sore throats, one after the other. His parents thought he just had a weak immune system. Again, a blood test told the real story: severe vitamin D deficiency. Little Samuel lived in an apartment with little outdoor activity or play due to his skin color, and long school hours meant his body really made enough vitamin D. His immune cells lacked the hormone they needed to fight viruses and bacteria and more. After sunlight exposure and supplementation by pediatrician, the infections slowed down. His mother said, I quote, "We didn't know the sun was part of his medicine." Yes, sunshine is vitamin. Sunshine is also his medicine. In fact, it's free medicine. That could go a long way. So I urge parents, health practitioners, caretakers to make sure we check the level of our patient's vitamin D because it can help a lot. That reminds me of Jean. He was a 40-year-old security guard. He began to feel constant muscle aches and weakness, especially when he was climbing stairs. Those muscles burned. Lifting any object felt heavy. At night, his bones ached as they were tired themselves. His x-rays were normal. Arthritis tests were negative. Then his doctor checked one simple level: vitamin D again. Jean was severely low of vitamin D. Without enough vitamin D, his muscles could not contract properly, and his bones were silently losing strength. After supplementation and regular sunlight and exercise, his pain gradually eased and his strength returned. And Jean said, as I quote, "I thought I was getting old. I was actually getting deficient in vitamin D." What I need to say to all of you today, the recommendation I like to make, especially for those of us with dark skin like myself, we need at least 20 to 40 minutes of midday sun to our face, arms, and legs, and make sure we get direct sunshine exposure. Nothing in between you and the sun rays. If we can do that 3 to 5 times a week, that would be splendid. We also need to eat adequately, properly. Food such as fatty fish, such as salmon, sardines, mackerel, egg yolks, fortified milk, and some cereals, mushroom, they all can provide some level of vitamin D. So I highly recommend that in your nutrition. You can add this thing. For those whose level maybe insufficiency in spite of sunshine exposure, in spite of the proper nutrition, then we highly recommend under supervision by a doctor that these people receive adequate vitamin D supplementation, usually between 1,000 international units to 4,000 international units. But some people may need more based on their vitamin D level, which your doctor can check for you. Children as well usually require between 600 to 1,000 IUs, we call that, which is called international units per day. Pregnant women, it's even more important to them because it's not only for themselves but also for the fetus. Pregnant women, we highly recommend that you talk to your obstetrician to check your vitamin D level because it may go a long way to have a normal delivery with a healthy baby. So we highly encourage that these things be done. In fact, my recommendation is for women who are planning to be pregnant to check the vitamin D level first and then talk to the doctors about if they need any supplementation or others. And when you go to the doctor, you can ask for a simple blood test called 25-OH vitamin D blood test. And the ideal range for people, for all of us, between 40 to 70 nanogram per milliliter. This is for optimal health. Anything below that needs attention. Anything above that also needs attention as well. I like to say God created the sun before he created any medicine. Light is not optional. It is biological fuel. To every parent, I'm speaking to you. Your child's brain needs sunlight. To every woman, your hormone needs vitamin D. To every man, your strength and immunity depend on it. To every family, sunshine is not a luxury, it is survival. Before I end this program today, I invite you to get your level of vitamin D check. Step into the sun, target, feed your body light. This is Dr. Milliardaire. Remember, the sun heals, the body listens, and prevention save generations. God bless you and thank you.